Can you talk about some of the main data archiving and application sunsetting projects you've been involved with? What did you learn from these experiences, and what are the main CIO skills needed to be successful in this kind of work?
So that's a very loaded question, and it's a very complex one. I'm happy to take a stab at it, of
Uh-huh.
course. You know, a lot of our footprint, as I mentioned in the intro, is in the ambulatory side. So that's about 80 plus ambulatory facilities, and then very concentrated because they're spread out only in about 3 to 4 counties in Middle Maryland. Most of them we acquired over time. So as you're acquiring these clinical facilities, sometimes they're coming with EHRs that are housed on-prem. Sometimes, more often actually, they're coming with EHRs that they're getting from somewhere else, or sort of like a cloud provider, just
Mhm.
because they're small clinics and they don't have the overhead of an IT team. So as you acquire them, as the CIO of the organization from the acquiring side, you have to figure out what to do with their data coming in. So not only building them and bringing them into your EHR, but also what happens with their legacy data. And then along with that, if you have a specific brand of EHR, as all of us probably know, you have a specific instance of that EHR, and it doesn't necessarily mean that another practice, another hospital somewhere else that's in your health system that you bring on board with the same exact EHR would be able to just combine their legacy data for a specific instance. So an example of that would be, even though we brought on 20 odd practices over time, the logos of the EHR vendors were probably about four or five. However, we had to maintain over a dozen different instances of EHR data, legacy data, simply because just because the logo was the same, the vendor was the same, it was a separate instance, and hence had separate data structures, different versions, and so on and so forth. So what I began to learn from this was that just because there is, and we talk about interoperability a lot in healthcare, but just because you have the same EHR vendor also doesn't always mean that you're going to be able to very quickly combine the legacy data archives and sunset those applications from running on a server somewhere just for archival access purposes. The other thing is, we often joke about this in healthcare, that a lot of the startups and innovation and innovative teams and companies out there, they're really just custom development shops that have a very niche sort of value proposition, whether it's an application or something that they do as a function. And then they have to build something custom around that to take it to production, to actually allow it to operate in an actual healthcare setting. Well, unfortunately or fortunately, it depends on how you look at it, whether you're Abhishek or whether you're Chuck and I. A lot of this archiving stuff is that it's actually a lot of custom sort of sorting and data manipulation to ensure that you can get to a state where some standard output comes out of it, whether it's a data structure, a central data warehouse from multiple different instances of legacy EHRs, and so on and so forth. That initial thing is always some level of custom data manipulation. And then what that essentially means is that a CIO just needs to be comfortable with the idea that there will need to be some level of partnership upfront. It's not just going to be a turnkey project that you say, you know what, I'm going to buy this, I'm going to plug it in and apply it somewhere in the data center. That's going to be it. There's not going to be any other manipulation, data transfer, transformation of any sort required. So this does take some care and feeding. And just because you have sunset an older application and you do need to keep that data around doesn't mean that it's going to be an easy road. It still requires a little bit of attention.